When we're checking reflexes, you need to be checking somewhere between 5 and 8 times, right? So this is the tendon, I'm grabbing around the tendon there to feel the difference. Like if I do this, I'm like, oh, that's bone, sounds like bone, feels like bone. Oh, it's softer and more bouncy there. The most overlooked and underutilized, yet most revealing neurological vital sign. In this episode of our Lumbar Spine Skills series, we're diving deep into the value of the reflex assessment, showing you why you're wrong if you think it's not valuable, and how to leverage this powerful tool to provide clarity in situations that would otherwise leave you scratching your head, right? Discover how to turn this underutilized tool into a game changer. So first things first, it all starts off with the reflex hammer, and if you don't do a cool little whoosh, reflex pistol spin, it doesn't work. I'm just kidding. But it is fun to do. So we need a solid reflex hammer, right? We need one that's weighted, ideally one that has a little tomahawk on the end and one that has this little, I don't know, whatever you want to call that, on the other end. If you're using that chintzy one that you got in school that has no weight to it, it just has this on both sides, you're gonna miss most, if not everything, okay? Very important that this thing is weighted, because it's like swinging a golf club. It's the speed of the end that matters, right? And that's what we need. We need the speed of this to be quick. And we need it so when I hold it, it just falls down, right? That's gonna make this a whole lot easier. And if you're trying to do it the other way, right, you're not gonna get as much speed and as much force through there if there's no weight on the end of it. So this is gonna be way better, okay? I'll give you a quick little close-up here. This is my favorite reflex hammer, the VarioFlex, right? If you don't have one of these, go ahead and grab one. Don't tune out, this is very important. The technique of holding and using this thing is what's gonna get you the information, right? If you don't have the technique down, just like swinging a golf club, you're not gonna get very far. So we wanna hold right at the end of this flat part with a pinch grip, so that allows this to just fall as we're going, right? I'm not squeezing it, I'm not holding it like this. It's resting right along here, right along my knuckle, and my thumb is pinching it there, right? And that allows me to use my fingers to pull, right? And at the same time, ulnarly deviate my wrist. So when I combine the ulnar deviation and the fingers, I get a lot of velocity at the end of that thing, right? And if you need to practice it, just get a table and just practice hitting in the same spot over and over again. And when you're doing that, practice leaving it there for a second. A lot of times when people are checking reflexes, they like tap it and try to pull it away really fast. It's like hit it and leave it. If the table wasn't there, this reflex hammer should go below the table, but the table is what's stopping it, okay? When we're checking reflexes, you need to be checking somewhere between 5 and 8 times, right? I know it's kind of a big range, but it just depends on which textbook you look at. They'll say 5 to 7 or 6 to 8. So we could just err on the side of caution and say 6 to 8, but I just like to say 5 to 7. Put them together, right? Because when we're checking reflexes, we need a few strikes to make sure that our strike is consistent. We're hitting the same spot, we're hitting with the same force. And then we need a couple of strikes for the reflex to build up. And then we want to see what is the consistency of the reflexes. So it's really those last few strikes that give us the best information, right? It's just like sleeping. If you only sleep for 75% of the time and you miss the last couple of hours, the last 25%, that's where most of the productive stuff happens in sleep. Total sidebar, but good information, right? So a lot of times when people are doing this, they're just gonna check it in sitting, and that's okay. Technically, it's a lot more hard, right? With the technical proficiency of it. So I'm gonna show you a much better way to go about it. Go ahead and lay it on your back, Caitlin. So starts off in supine, and if somebody has pain here, you can just elevate the end of the table a little bit, right? Because it just puts them in a ton of extension, and this takes away the extension. But we're gonna stay here because it feels fine, correct? All right, so you don't need a bolster or a foam roller. However, it's highly recommended. You could use a $100 Sweet medical bolster, or you could use a $16 Amazon Basics foam roller. Either way works. So I'll show you how to do it with, and I'll show you how to do it without, just in case for some reason you don't have something, which you probably should. But go ahead and bend your knees. We're just gonna slide this right underneath your knees. Go ahead and relax over top of it. And then we're gonna get set with our reflex hammer. Make sure it's in a good striking position. Then we're gonna find the tendon, right? So we're gonna test L4 reflex here, right? L4, L5, S1, most common nerve root irritations. That's really where you're gonna have to check a lot of. It's gonna give you a lot of clarity, right? And yes, it's not a single spinal segment that comes down here. This is just highly innervated in most people by those spinal segments, right? So you can find the kneecap by touching it, and you find the tendon, and if you keep going down, you'll find the tibial tuberosity. You want to go in between the patella and the tibial tuberosity, right on the tendon. You can also use the reflex hammer here to feel the difference. Like if I do this, I'm like, oh, that's bone. Sounds like bone, feels like bone. Oh, it's softer and more bouncy there. All right, if I keep going down, that's bone there. So I want to outline that area with my fingers, ideally, not 100% necessary, but when you're learning, you want to have a visual for you to strike and aim for, okay? So here, I'm just resting my hand on her thigh, so if she doesn't get a visible contraction here, I can see it and I can feel it with my hand a little bit. So we're gonna hit 6 to 8 times, 5 to 8 times. Letting it rest. Right? So you can see she got 1 or 2 that came up, but the consistency of it is that she just gets that little bit there, right? Not a big jump. So when we test the other side, we want to stay on this side of the table so we can use the same hand. Most people are going to feel really good with one hand and it's not going to be the same with the other. And if you have 2 different strikes, if you're really good with one hand and not so good with the other, you're going to get good results and then not so good results, right? So we just lean across the table, do the same thing, find where we're going, and hit her with a hammer a whole bunch of times. Right, now we know the consistency and those last few strikes are what gives us the best information. So when we're looking at L5, we're going to externally rotate her, which is going to give her a little abduction as well. And then we have to pre-stretch the hamstring tendon. So when you find it, get underneath it, grab laterally to it. You got to hook your fingers so you can actually grab the tendon, right? So this is the tendon, I'm grabbing around the tendon there, okay? So here I'm grabbing the tendon and I'm going to compress it, pull it into her femur, and I'm going to pull it distally, so I'm pre-stretching it. And then I'm going to hit my fingers kind of on the knuckle towards the nails there. If I try to just hit her leg, I'm not really going to get any good information. It's going to be really hard for me to do anything effectively there because the tendon doesn't have a little bit of stretch on it already. So we're going to pre-stretch here, right, to the femur, and then distally, and then we're just going to hit our fingers. Now what I'm doing when I'm doing this is I'm watching her hamstring. I'm feeling with my fingers and I'm watching. We're not going to get knee flexion because it's blocked by the table. It can't go anywhere, right? So 1, 2, 3, 4, 5, 6, 7, 8, right? And then for this side, we are going to walk around to the other side because again, we have to pre-stretch the tendon. So same position with the leg, same thing, pull in towards the femur, drag distally, come around, hit that same spot on your fingers. Good, right? And again, we're looking for asymmetries here, right? A lot of times when people are looking at reflexes, they think if there's hypermobility, then there's maybe an upper motor neuron lesion, and that's not quite true. If you have like global hypermobility, that's more of an upper motor neuron thing. If you have a single spinal nerve root or a single reflex that's hyperreflexive. I have no idea if I said hypermobile before. Whoops, hyperreflexive, not hypermobile. If you have one that's hyperreflexive, that just shows you that that nerve root's a little bit irritated, right? Typically, if it's a little bit more acutely irritated, then you'll have a hyperreflexive response. If it's a little bit more chronic, then it will be hyporeflexive. Or if you have a legit compression, it might be hyporeflexive as well. Don't go talking about compression and all that stuff to your patients. Just use the words irritability, right? Because we don't want to give any nocebic language. So then when we're looking down, so that was L4, L5, and then when we look at S1, it's going to be the bottom of the foot. It is the same thing as the Achilles reflex in sitting. We're just going to hit the plantar surface of the foot as we're going along, okay? So here we have to lift up her leg so it clears the table. And what we're gonna do is keep our pressure on the lateral border of her foot as we go along, right? So on this side, I'm gonna hold here. So I wanna match that force, wherever I'm putting this force here, I wanna match it on the other side. If I'm holding here, it's gonna give me different information, right? There's nothing that happens there compared to this side over here, we get a little bit of a reflex, right? And if I just put my pressure in that same spot laterally, either by pushing this way and holding there, you can see we get a reflex there, or I could come over the top and keep pressure there, right? Either way, you just wanna stand somewhere where you can see where you're hitting with the hammer. Where we wanna hit is gonna be on that distal part of the fifth metatarsal, all right? We don't wanna hit in the middle of the foot or towards the back of the foot. We wanna hit distally on that fifth met as much as we can. So I kind of hold on to the head of it here and then pull into a little bit eversion and dorsiflexion and then look at where I'm hitting. Right? And then other side, I'm gonna stay on this side of the table, lean across, and I'm leaning on the table, so I'm not just bending over here. I'm taking some of that load out of my back, keeping my own body mechanics good. Right? And if I were to hit in different spots, if I hold down here and I hit here, there's a big difference compared to what I get up here. Right? So we have to make sure that we're hitting distally and we're hitting the same spot on each foot. And if you don't lift the foot up, then you're not gonna get good information because it's gonna be blocked by the table. So then if you don't have a foam roller, you just go ahead and take this thing out. You just use your body, right? So check in the quads here. You could just hold her in this position and angle yourself to get in there and check them. A little bit more technically difficult, right? Because I'm kind of jammed up here. We can check the other side as well. I actually prefer to just use my leg and do it one at a time. So I'll come around here and I'll hit this way, right? Now, the downside to that, if you use your leg, is that you have to be good with your other hand, because then if you come around this side and you do it here, you have to use your other hand. You can't do this at this angle here. I mean, you could, but it's super awkward. So if you don't have something to put between or underneath your legs, maybe unless you've developed that proficiency with both hands, just put your hand underneath, right? And then same thing here for the hamstring. We got her set up in that position, and I just brace it on my leg there as we go, right? And then same thing, we come around the other side, and I just use my other knee and then pull and drag. I use my other knee because I want to be down distally. If I use this knee, I'm way up here and it just makes it harder and I can't hit in the same capacity, the same angle, the same spot. And then when we're looking at the ankle here, this gets a bit tricky because now you've got to balance the weight of her leg because we don't want her holding her leg up. So her knee kind of rests out into you, and then we're holding down here, looking to see where are we hitting, right? We hold this way a little bit, right? You can see, get a little reflex there, right? A little bit different than what we get up there because I'm not able to keep, or a little bit different than what we get when we have the bolster underneath it because I'm not able to keep that solid pressure on the outside of her foot unless she's got little tiny feet and I've got big hands, right? We just have to do the best that we can. And then for the other side, we want to make sure that she's not holding it out, so we actually have to bring her foot out and then her knee comes in. But now there's a big difference in the force that I get, right? This side, I'm able to keep my force on that lateral border. This side, I have to try, but it's not nearly as effective. So if for some reason you don't have something you can put underneath there, that's a way to do it. But likely in your clinic or at your house, you have something that you can put underneath them to get better information, okay? Very, very important that you guys get a good reflex hammer, that you practice the strike, and then you build the bank of what this stuff feels like. Little tip for you too, go ahead and bend your knees again. With L4, if somebody's super hyper reflexive, you hit them on both sides and they just get like this huge jump and you're hitting them very lightly, you can actually tap on the on the quad tendon instead of down here on the patellar ligament technically, right? You can hit right above the kneecap. And Caitlin doesn't get a big one because she's not super hyper reflexive, right? But she gets a little one that I can feel. Can't really see it too much. But if somebody is super hyper-reflexive, that's the way to tone it down a little bit. And the force in which you strike is very important as well. If I'm just tapping her, right, I'll get one reflex, but if I hit her harder, typically that'll come along with a little bit of a bigger reflex, right? So just tapping gently versus a little bit bigger here. So with Caitlin and her quads, not a big difference. There we go, get a little bit there, right? But maybe down here you can see a little bit better. If I do a soft strike, we get a little bit. And if I do a hard strike, we get a much larger reflex going on there, right? So you can play with the force. And if you're ramping it up and you're doing 6 to 8, it gives you a little bit of leeway with that. And you have to go, if you have to go beyond 6 to 8, like it's not a big deal, right? Like that's not terribly uncomfortable when I'm hitting you. If you're testing up in the upper extremity and you're doing brachioradialis, like then that can get a little uncomfortable because you're just really hitting their radius. But the rest of this stuff, fairly well tolerated for most people. And that's it for this episode, guys. I'm Doc Raj.
I'm Doc Caitlin.
And we're the co-founders of the Performance Rehab Authority. Hopefully you guys found this episode useful. If you take this stuff, use it in the clinic, leave a comment and let me know how it goes, or if you have any questions. We'll see you guys in the next episode.